and Samantha from the New Zealand Pompe network. So Alyson's going to give us an update about our Kiwi friends, and then Samantha is going to share her patient story. So over to you, Allyson.
Thank you, Maddie, so much. I'm a little nervous, so I've got my notes. Thank you, APA, for including your poor cousins from across the ditch. Very much appreciated. So I'm going to give you just a brief overview of things in New Zealand. I've got Pompe. I was diagnosed in 2010. My twin brother about a year later, and Renee, who is on the APA, is my cousin. Our mothers are sisters, different fathers, thank goodness. Then I was on a trial with the lovely Dr. Byrne from 2011. I went there for 6 months. So wonderful to see him on here today. He is my absolute hero. Information on New Zealand, we have 13 patients. I was the 4th one, so we've grown a little. 13 patients, 1 infant this year. This is the first infant that we've had that we know of, which is on funded treatment. Only infants get funded treatment in New Zealand currently. We have 2 not wanting any treatment, 5 on clinical trials, and 5 on compassionate access through Sanofi, for which we're so grateful for. It's extremely important that we have access to RCAP and to clinical trials. Just putting that out there for the companies who are on today to not forget New Zealand. You know, we even though we don't have funded access, we are still working on that. We're not being lazy and just accepting, you know, anything we can grab our hands on. We are still working hard. This year we have done a GP and specialist mail out to all of the GPs in New Zealand that we could find, which was a very long and arduous task because there's not a central register of doctors that you can get your hands on. Also, we sent out we sent out this little, I don't know if you can see that, things around the wrong way. This guy, no, I can't see it. He's a little zebra. Here he is. God. And also we designed a Pompe disease 101 basically for GPs. We wanted everyone, all GPs, to know when someone presented with weird symptoms like we have, that, oh, you know, think outside the box, think about a zebra, not a horse. So we've had some good feedback about that, and a lot of requests for test kits for dry blood spot. And if we get any positives for that, then we can go through Nandor, who just spoke, for the in vitro program. So thank you, Nandor, for working with us on that. That's much appreciated. We're also hoping for companies who have funded approved medications that they will put applications into Pharmac, because we need that to happen for them to consider funding for us. So please keep doing that. And we're just working hard on making sure medical people have the knowledge of our disease, know what to look for, and then we can help them going forward, like the enzyme testing and the genetic testing, and then getting people onto trials and you know, ICAP if needed. And our most recent patient managed to get on ICAP as well, so that was really heartwarming that we didn't have to say no, there's nothing for you. So really glad to be able to do that. So and in the end, my little quick message is, please remember New Zealand. I know I keep sticking that out there, and maybe I've got a little island chip on my shoulder, but we just need to make sure that people remember us down here, down under. And thank you again, Raymond and the APA.
Hi, I'm Samantha, and I'm from New Zealand, but currently live in Australia. I have 2 gorgeous kids, and I work for a not-for-profit organisation, and I'm Vice President of the New Zealand Pompe Network. I'd like to thank the APA for giving me this opportunity to speak today and just give you a little understanding of my patient journey, and also for me for accessing treatment outside of my own country. In terms of my road to diagnosis, I was always a pretty active kid, competing in sports days, playing hockey through to university, enjoyed going to the gym and walks and keeping fit. For me, symptoms appeared after the birth of my son in 2007. Running and aerobic classes were leaving me out of breath, getting harder and harder. I was beginning to stumble and fall a lot. And it was about 7 years of trips to doctors and physios, complaining of back pain, leg pain, stumbling, feeling out of breath before I was eventually diagnosed. I was actually diagnosed in 2014 after returning from living in the UK on a military posting, as my husband is in the New Zealand Defence Force. A great physio in England had been the first medical person to say to me something wasn't right. She knew that I had thrown myself into getting fit, and I thought that was what was wrong with me. I was just unfit. And yet she said to me at 38, I had the muscle strength of a 60-year-old. On my return to New Zealand, I went to my GP and he was shocked at my deterioration, and he referred me to a neurologist, who then carried out several tests, one of which was the dried blood spot test, which came back as positive for Pompe. As we know, receiving any sort of life-threatening diagnosis is distressing. I remember feeling conflicting emotions and relief also at knowing what was wrong, but also an immense loss on being told I had Pompe. I immediately thought the worst, and I thought I would not get to see my young kids finish high school, that I would lose so many freedoms that I'd taken for granted, and I hated to think about my loss of independence and what that would mean for my family. But in New Zealand, being diagnosed with a rare disorder means that if there is a treatment available, in New Zealand, it is highly likely the treatment is not funded. For me, hearing there was an ERT I could not access was even harder to come to terms with than receiving my diagnosis. As you may know, Myozyme has been approved since 2006 and over 60 countries reimbursed, but not New Zealand. The mental repercussions and the physical deterioration due to lack of access to medicine was soul-destroying for me and my family. But after a few months of feeling very sorry for myself, I decided I wasn't going to let this destroy me, and decided to fight to get access to treatment and raise awareness about the lack of medicine access in New Zealand. I have campaigned for 8 years now alongside Allyson and some of our other Pompe patients. I have met with members of Parliament, appeared before the Parliamentary Health Select Committee, met with senior leadership team members of our drug buying agency Pharmac, and contributed to numerous Pharmac panels and consultations. It is exhausting, incredibly frustrating, and soul-destroying to constantly fight for equitable healthcare in New Zealand. We are not a third world country, and yet our investment of medicines as a percentage of our health budget currently ranks us at the bottom of the OECD. I will keep fighting until I can see a change from our government. But back to 2016, when I was given hope, and myself and another young patient were accepted onto a clinical trial for a new ERT in Australia. My husband and I discussed the fact that it meant I would be travelling to Australia at a time when he was a captain in the Royal New Zealand Navy and mostly at sea. We were worried the impact of both of us coming and going would have on the kids, but we knew it was an opportunity I could not turn down. I felt that my walking and breathing at that stage was becoming worse. So in September 2016, I started flying every fortnight from New Zealand to Adelaide to be able to access the treatment. I was incredibly lucky to have an extremely supportive family in my husband's family, as all of my family live in the UK. And my in-laws were amazing, and they stayed with my kids while I was away from a Tuesday to Friday every other week. But 1 year into my treatment, we were all devastated when my father-in-law passed away. He had been so amazing with my kids, and after his passing, my mother-in-law was not able to continue to look after my children. This was a really worrying period for us all, but with the help of some amazing friends, the kids were looked after for a few of my trips away until we managed to find a nanny. This only ended up being for 6 months with a nanny, which was a good thing, as the kids did struggle a bit with someone they didn't know very well. When I look back on this period though, I'm so incredibly proud of all my kids have had to endure with a dad and a mum gone for a great period of time in their lives. Then in 2018, we were again thrown a lifeline when my husband was offered a job in Australia for 3 years with the New Zealand Defence Force. And in October 2018, we moved to Canberra. Flying a 1-hour flight from Canberra to Adelaide was life-changing. My first trips from Auckland to Adelaide, had taken me all day, because when I started flying, there were no direct flights, so I had to fly via Sydney. Living in Australia was so much easier. I still flew out the night before treatment and stayed in a hotel, but after protocols lessened on my treatment, I was then allowed to travel home on the same day. But it gets better. In August 2019, my wonderful team at Adelaide Hospital set up home infusions for me through a nursing agency, which I know I am extremely lucky to receive. I now receive ERT at home in Canberra, and I know I cannot talk about the effects of the treatment, but importantly for me, it has enabled me to start work again, be an active mum, and mentally given me hope. I'm now preparing to return to New Zealand as our defence posting here comes to an end at the end of November. So I'm currently going through the process of liaising with the Adelaide team, the drug company, and the staff at the Auckland trial site to try to establish home infusions for me in New Zealand. Luckily, for the other patients on the trial in Australia who were Kiwis, they set up a trial site in Auckland. So those people no longer had to travel as well from Auckland to Adelaide. Unfortunately, I'm returning to Wellington, and with COVID adding to the mix, it would make it hard for me to fly domestically between Wellington and the trial site in Auckland, and I don't know how comfortable I feel about the idea of doing that as well. Home infusions would be so much easier, but protocols in New Zealand are making it a little trickier to establish. But I know there are wonderful teams of people working on this, and I hope that it will be possible. Even though all the travel to and from Australia and then within Australia was tiring, it was so worth it. The benefits from treatment outweigh all the upheaval, and I know my husband and kids, who are now 12 and 14, would definitely agree. I also wanted to say that I remember coming to the first APA conference. I'd been diagnosed that year, and I was still coming to terms with everything. For me, to meet others with Pompe and hear from experts, and to see everyone just living their lives really made a huge positive impression on me. I felt like I had found my tribe and that there would be friends and people I could call on for years to come. And it's very true. Thank you, everyone.
Thank you. Thank you so much. You've actually got me a little bit emotional, Samantha. That was a really great story. It's just really powerful. So, we've got some time for some questions. So if anyone's got some, please send them through. But I just wanted to say that both of you and the rest of the New Zealand Pompe network are just the true definition of Pompe warriors, I think. So that term you often hear within the Pompe community, but I just think for what you guys go through to advocate for treatment and for health equality and for everything that you guys do over there is just amazing. So it's sensational. So those stories are really, really appreciated. So keep up the good work, and fingers crossed you guys can get there one day. And Allyson, I know you are literally world renowned for your efforts for what you do for New Zealand patients. So you should both be very, very proud. But once again, thank you. Thank you for coming to us today and sharing your story. So that's great. We have had, it's not necessarily a question, but Taryn is crying. So
I was nearly crying, Sam. I do actually have a tear. You were wonderful.
Yeah, it was a very moving speech.
Oh, but it's just yeah. I mean, we've all been on that patient journey. We've all had our ups and downs, and we've all had hurdles that we have to jump over. But I really do also believe that having these connections, even virtually like this, is just so important for all of us, and especially more so for the Kiwis, because we do feel a bit cut off and we're small in number. So being able to connect with the Australian groups is a really big deal.
Yeah, definitely.
And I hope that these joint Pompe Down Under conferences will continue. As I said at the start of the day, I think it's so great that we all can join together. So fingers crossed we keep going.
Yeah.
Another comment in the question box, someone just saying, we can't imagine how tiring it would be. I'm assuming they're talking about the travel to and from treatments. It must be so hard. Maybe 5 or 6 years was so hard. So definitely agree with that sentence there.
It is tiring, but worth it, isn't it, Sam?
Definitely. Yeah. I mean, I'd say to anyone, you know, with gene therapy trials coming on, you know, if you have the opportunity to participate one, really seriously consider, even if it is outside of your country. You know, just think of the bigger picture, the longer term. Yeah, just, you know, if you can do it, then try and make it happen.
Oh. I see a question there from Raymond. Can infants
Yes.
in New Zealand get treatment now? Yes, they can, from 1st of December 2016. But this year is the first time we've had one that we know of that has been diagnosed anyway. So I don't know anything about the age of it, but if you're diagnosed 2 years and under, you can get treatment.
Is that infant offset patient a member of the network, or have you spoken to them?
No, we don't know who they are. We don't know anything about them. So yeah, unfortunately, but at least it's great to know that they're getting treated. And the reason I asked Dr. Krishnani, you know, because there used to be infantile onset, juvenile, adult. But Pharmac here in New Zealand, our drug buying agency, said they would welcome applications for drug funding for Myozyme for juvenile patients. So that's interesting, because by definition now there isn't juvenile. So if they would take juvenile, then they really have to accept adult, because juvenile is adult onset.
Yeah, it's the same thing as we all learned today. So very interesting. Well, I do hope that patient, great that they're getting treatment, but I do hope that they find support with you guys, because as Samantha said, sometimes it's just such a huge comfort to know that there's people that actually understand what you're talking about and what you're going through. So fingers crossed.
Absolutely.
I don't think there's any other questions. Anyone? No. All good. Well, thank you both. As I said, thanks for sharing your time, and it's been great to have New Zealand join in. So I hope you enjoy the rest of the day.
Thank
you very much.
Thank you.
No worries.